Vision. What is it? Vision is a physical, mental, and spiritual phenomena of enlightenment. My name? My name is Reverend Dr. Leonidas A. Johnson, better known as Rev. Leonidas the Optometrist. I'm an ordained minister and licensed optometrist. I've also studied acupuncture and integrative medicine. I'm a board-certified health coach and have a license to practice massage therapy and Asian bodywork. I want to welcome you to Vision Crossroads, the place where we gather at the intersection of light and sight to focus on health, wellness, and fullness of life. Vision Crossroads is a 12-episode podcast featuring the 7 principal precepts of my phenomenal VIP program, officially known as the Rev. Leonidas the Optometrist Phenomenal Vision, Intervention and Prevention Visual Literacy Program. Completion of all 12 episodes of Vision Crossroads is required to be eligible to receive a certificate of completion. It may also be required that the participants pass a quiz at the end of the program. Life is full of crossroads. When we come to a fork in the road, how do we decide which way to go? Maybe you made a bad decision and now you are standing at a crossroad, a fork in the road, wondering what should you do? What step should you take? What move should you make? Wondering and wondering, what should you do? Vision Crossroads, featuring the Phenomenal VIP program, is designed to help you understand and be more familiar with the decision-making process when making life-changing decisions in your life. The lyrics to the song entitled Live Your Best Life by Brent Jones states, "It's good to be alive, but it's best to live." I like to say it a different way. It's good to be alive, but it's best to thrive. I've been helping people to see more clearly for over 40 years, and I want to help you see how vision can help you grab all the gusto life has to offer. I want to help you focus more clearly on human volition, also known as human will or willpower. Volition is the mental and emotional process of deciding what to feel, think, and do. Mental processes include psychosocial processes. Helping you to see human volition more clearly is my hope and prayer that you become more comfortable and efficient in making important life-changing decisions in your life. Living your best life means making major lifestyle choices. For instance, you must make important decisions about smoking, alcohol abuse, physical exercise, diet, sleep, water intake, substance abuse, and sexual activity. Living your best life also requires making decisions about what is truth and decisions about the meaning and purpose of life. Kirk Franklin talks about making your next chapter your best chapter in his song entitled Love Theory. Do you want your next chapter to be your best chapter? In the words of S.M. Lockridge, the decision is yours. Let's talk about vision and how vision can not only help you make your next chapter your best chapter, but also how vision can help you live your best life and experience the fullness of life. To walk in the fullness of life, there must be a newness in your view of life. This program was written and produced by me, Reverend Dr. Leonidas Johnson, and is presented to you by the Rev. Leonidas the Optometrist and the Miracle Eyes Foundation, a 501c3 nonprofit organization. Copyright 2025, the Johnson Living Trust. Episode 5, Medical Eye Conditions, Bringing into Focus Unseen Dangers. The ancient proverb states, "Where there is no vision, people perish." Proverbs 29, verse 18. You will not be able to live a long life, a healthy life, or your best life if you have no vision. Let's bring into focus unseen dangers to vision. Uncorrected refractive errors can cause poor visual acuity, loss of vision, and blindness depending on the severity of the refractive error. Uncorrected refractive errors is a leading cause of blindness in the world. Poor visual acuity, loss of vision, and blindness can also result from medical eye conditions. Comparison learning can be applied not only to optical refractive conditions, but also to medical eye conditions. Medical eye conditions result from acute and chronic diseases, infections, injuries, inherited genetic conditions, lifestyle factors, environmental factors, and tumors. The leading causes of loss of vision and blindness due to medical eye conditions include macular degeneration, glaucoma, cataract, and diabetes. High blood pressure can also cause loss of vision. The leading medical eye cause of blindness due to infectious disease is trachoma, followed by river blindness, onchocerciasis. Other medical conditions that cause blindness from infection include corneal ulcers, especially associated with contact lens wear. Medical injuries caused by the sun's UV light rays that can cause loss of vision and blindness include cataract and solar maculopathy. UV light can also cause inflammation-prone tumor-like growths on the eye called pterygium and pinguecula. Inherited conditions include strabismus, keratoconus, and migraine headaches. Tumors that can cause loss of vision are retinitis blastoma and Kaposi sarcoma. These conditions can not only affect vision, but our health, wellness, our ability to live our best life, and experience the joy of living the fullness of life. Uncorrected refractive errors like myopia, which is nearsightedness, hyperopia, which is farsightedness, and astigmatism, which affects both near and far vision, can cause decreased vision and permanent vision loss if uncorrected at an early age. To prevent loss of vision from uncorrected refractive errors, I recommend a routine yearly eye exam by an optometrist beginning at the age of between 3 and 5, earlier if you suspect eye problems, and wear prescription eyeglasses or contact lenses as prescribed by your optometrist. Myopia. We talked about myopia, that is nearsightedness, as being a refractive condition. Myopia is not only a refractive condition, but also a disease. High myopia significantly increases the risk of developing several serious eye conditions later in life, such as myopic macular degeneration, retinal detachment, posterior subcapsular cataract, and glaucoma. Treatment for the disease of myopia is called myopia management. The goal of myopia management is to slow down the progression of myopia by slowing down the growth of the length of the eyeball, known as the axial length. Treatments can include medical eye drops, orthokeratology, which is a special rigid gas permeable contact lens worn at least 7 hours during the night, soft multifocal contacts worn for at least 7 hours during the day, and special eyeglass lenses designed with a peripheral myopic defocus zone. All treatments should include time outdoors. Outdoor activities can help prevent both myopia onset and myopia progression based on the amount of time spent outdoors. Remember the 20-20-20 plus 2 rule. For every 20 minutes of near or digital device work, take a 20-second break to look at something 20 feet away, plus spend at least 2 hours outdoors each day. Myopia management is a specialized service provided by optometrists. What is macular degeneration? Macular degeneration is a medical eye condition that can cause loss of vision and blindness. Macular degeneration is a degenerative condition affecting the central part of the retina, an area called the macula, which causes loss of central vision and central vision blindness. Peripheral vision or side vision remains intact and is unaffected. Key risk factors include Caucasian race, age over 50 years, light-colored eyes, certain medical conditions like high blood pressure and cardiovascular disease, and family history of macular degeneration. Modifiable risk factors include smoking and obesity. A diet low in antioxidants and a diet low in healthy fats can also contribute to the risk. Light-colored eyes are more susceptible to macular degeneration because they are more susceptible to damage from ultraviolet light from the sun. To decrease the risk of macular degeneration, wear protective eyewear that blocks UV light rays and add kale, leafy green vegetables, and antioxidants in your diet. What is glaucoma? Glaucoma is a medical eye condition that can cause loss of vision and blindness. Glaucoma is a condition that damages the optic nerve that causes loss of peripheral or side vision. Central vision remains intact and is unaffected in early stages of glaucoma, but end-stage glaucoma can cause complete loss of vision. Chronic open-angle glaucoma is the most common type of glaucoma. Glaucoma is often called the silent thief because it usually does not cause pain or blurred vision or loss of central vision, and noticeable symptoms may not occur until late stages. The primary treatment for glaucoma is lowering the intraocular pressure with the eye drops or eye surgery. Medical and surgical treatments for glaucoma can only slow down or stabilize vision loss. Currently, there are no treatments that can cure or eliminate glaucoma. Smoking marijuana does not cure glaucoma. Key risk factors include African American or Hispanic descent, increased intraocular pressure, unequal-sized optic nerves, age 40 and above, family history, and decreased corneal thickness. Vision loss from glaucoma is not recoverable, and there is nothing that can be done to offset the risk for glaucoma, so it is best to have regular yearly eye exams to monitor for glaucoma so it can be diagnosed and treated before there is vision loss. What is cataract? Cataract is a medical eye condition that can cause loss of vision and blindness. Cataract is the clouding of the eye's natural, transparent intraocular lens causing blurred vision. The most common type of cataract is age-related cataract, and the most common cause is exposure to ultraviolet light rays from the sun. Age-related cataracts develop slowly over time and are related to the amount of ultraviolet light exposure over the course of one's lifetime. There is more UV radiation exposure at geographical locations close to the Earth's equator and at high altitudes. A diagnosis of decreased vision due to cataract at age 70 is common. Cataract is the leading cause of blindness worldwide. Leading risk factors for developing a cataract include increased age, increased exposure to sunlight, smoking, diabetes, and obesity. To decrease the risk of cataract, wear protective eyewear that block ultraviolet light rays. There are different types of cataracts. The three most common types of age-related cataract are nuclear sclerotic, posterior subcapsular, and cortical. A nuclear sclerosis cataract develops as a general haze that usually grows evenly throughout the lens. A posterior subcapsular cataract is a cataract that usually starts in the center of the lens and grows outward towards the outer edge. A cortical cataract generally grows from the outer edge of the lens towards the center, but also can grow in spotty patches. Some patches may be close to the center of the lens, while other patches may be located closer to the outer edge. What does diabetes have to do with vision? Diabetes is a leading cause of blindness. Diabetes is a medical condition that can cause loss of vision and blindness. There are two major ways diabetes can affect vision. The first way diabetes can affect vision is by the effect the blood sugar level has on the intraocular lens. When the blood sugar level is 200 or higher, the refractive error can change as the blood sugar levels change. If the blood sugar level is higher than 200 at the time of an eye exam for glasses, it is not recommended that glasses be prescribed because the vision and the measurements for prescription glasses could be unstable. High blood sugar levels can cause a diabetic shift in the eyeglass prescription and a change in the index of refraction of the intraocular lens. The index of refraction is a measure of how light is refracted or bent when passing from one transparent medium to another. When the blood sugar level is below 200, the vision and the measurements for prescription glasses are reliable and glasses can safely be prescribed. The change in vision due to changes in blood sugar level is a temporary change. A more permanent type of change that can occur to the intraocular lens due to high blood sugar levels is the development of a diabetic cataract. The most common type of cataracts caused by diabetes are post-subcapsular cataract and cortical cataract. The second way diabetes affects the eye can be more permanent and can lead to blindness. The second way diabetes affects the eye is by way of the effect diabetes has on the small blood vessels throughout the whole body. Diabetes causes small blood vessels to leak and bleed. When this happens in the eye, it is called diabetic retinopathy. Diabetic retinopathy can lead to permanent blindness. If there are leaking and bleeding blood vessels in the eye, which is an in organ, then we know the same thing is happening in other organs like the kidney. Regular yearly eye exams are important in the management of diabetes. The eye is the best place where these small blood vessels can be seen and examined using non-invasive methods. Risk factors for diabetes includes excess weight, waist size, sitting, family history, race and ethnicity, blood lipid levels, age, and prediabetes. You can reduce your risk of diabetes with diet and exercise. What does high blood pressure have to do with vision? High blood pressure or hypertension is a medical condition that can cause loss of vision and blindness. High blood pressure, also known as hypertension, is a health condition when the blood flowing through your blood vessels and pushing against the artery walls is consistently too high. High blood pressure is called a silent killer because nearly half of adults who have high blood pressure don't realize it. Uncontrolled high blood pressure can cause strokes, heart attacks, kidney failure, and early death. In the eye, high blood pressure can cause retinal artery or retinal vein occlusions. High blood pressure can also cause an eye condition called hypertensive retinopathy. Like diabetes, High blood pressure can cause the blood vessels in the eye to leak and bleed, increasing the risk of loss of vision and blindness. Infections can cause blindness. Eye infections can cause loss of vision and blindness. Eye infections are caused by microscopic organisms that include bacteria, viruses, fungi, and parasites. The most common cause of blindness from infectious disease is called glaucoma, followed by river blindness. Glaucoma is most commonly found in rural areas of developing countries like Africa, the Middle East, the Indian subcontinent, Southeast Asia, and South America. Glaucoma is transmitted by flies that come in contact with eye fluids and discharge from an infected person. River blindness is most commonly found in sub-Saharan Africa and to a lesser extent in South America and Yemen. River blindness is carried by the bite of the black fly breeding in fast-flowing rivers and streams. In the United States, a common cause of blindness from infectious disease is herpes simplex and cytomegalovirus. Corneal ulcer is another common cause of blindness due to infectious disease. Injuries can cause blindness. Eye injury and trauma continue to be a major cause of blindness. It is wise to use protective eyewear to avoid corneal, foreign body, and corneal abrasions. Corneal abrasions can also occur from liquids and chemical fumes. Eye injury can occur from the ultraviolet light rays from the sun. Solar burn retinopathy can cause blindness. Other types of eye damage that may occur from the sun include a non-cancerous tumor-like growth on the eye called pterygium, also known as carnosidad in Spanish and as surfer's eye in the surfing community. This growth is not a tumor. When the growth is on the white part of the eye, the conjunctiva, it is called a pinguecula. No surgery is required. When the growth goes beyond the edge of the white conjunctiva onto the clear cornea, it can cause irregular astigmatism and decreased visual acuity. When the growth involves the clear cornea, surgery may be a good treatment option. With both conditions, pinguecula and pterygium, the eye becomes more sensitive to wind, dry climate, and ultraviolet light exposure. Protection from UV and the use of over-the-counter artificial tears is the typical treatment. Pterygium and pinguecula do not cause blindness. Inherited conditions can also cause loss of vision. A common inherited condition that can cause loss of vision includes strabismus, commonly known as cross eyes or eye misalignment or eye turn. Treatment for strabismus includes vision therapy, glasses with prisms, and may also include eye muscle surgery. Other common inherited conditions that can cause loss of vision are retinitis pigmentosa, corneal dystrophies, keratoconus, and ocular migraine. Vision therapy is a special service provided by optometrists. Tumors and cancer can cause loss of vision. Common tumors and cancers of the eye that cause blindness include retinoblastoma, Kaposi sarcoma, and melanoma. This is Vision Crossroads, the place where we gather at the intersection of light and sight to focus on health, wellness, and fullness of life. Vision Crossroads introduces and features the 7 principles and precepts of my phenomenal VIP program, which is officially known as the Rev. Leonidas the Optometrist Phenomenal Vision, Intervention and Prevention visual literacy program. Vision is a physical, mental, and spiritual phenomena of enlightenment. When we define vision in this manner, we are referring to phenomenal life-sight vision, also known as phenomenal vision. At Vision Crossroads, we use a technique called learning by comparison. We look at physical vision and show by comparison that physical vision is like mental vision and spiritual vision. Then we relate mental vision and spiritual vision to mental and spiritual issues in life. The term mental vision also includes the psychosocial aspects that influence mental processes. At Vision Crossroads, we look at how physical vision, mental vision, and spiritual vision compare and relate to the three dimensions of human existence: body, soul, and spirit. We look at the three dimensions of the human soul: emotion, mind, and volition, and bring into focus the important role the human soul plays in the decision-making process. At Vision Crossroads, we focus on how vision, phenomenal vision, can help you grab all the gusto life has to offer. At Vision Crossroads, we look at how vision, phenomenal vision, can help you make your next chapter your best chapter. At Vision Crossroads, we help you see more clearly how vision, phenomenal vision, can help you live your best life. At Vision Crossroads, we help you see more clearly how vision, phenomenal vision, can change your outlook of life and put you on course to walk in the fullness of life. At Vision Crossroads, we use the technique of learning by comparison. Just as clear vision from a pair of glasses can change the course of a child's life, a clearer understanding of phenomenal vision can change the course of your life. This program was written and produced by me, Reverend Dr. Leonidas A. Johnson, and is presented to you by the Rev. Leonidas the Optometrist and the Miracle Eyes Foundation, a 501c3 nonprofit organization. Copyright 2025, the Johnson Living Trust.